Before cancer had treatments, it had only rituals, surgery, superstition, silence. But in the 1940s, one man would challenge that silence. His name was Sidney Farber, and he would become known as the father of modern chemotherapy. This is the story of a quiet rebellion in a hospital basement, and the spark that lit the modern war on cancer. In the 1940s, acute lymphoblastic leukemia, especially in children, was one of the most terrifying diagnoses. It came on suddenly, often in toddlers or young kids, and progressed with cruel speed. Fatigue, bone pain, bruising, and death. Usually within weeks. There was no cure. Most doctors wouldn't even attempt treatment. Leukemia wards were quiet places for waiting. Around the same time, scientists had discovered that folic acid, a vitamin, could stimulate blood cell production. That gave Farber a hypothesis. If folic acid fuels leukemia, what if we gave patients a drug that blocked it instead? It was a radical idea. He wasn't an oncologist. He was a lab pathologist, operating in the basement of a hospital that didn't fully support his work. But he moved forward with a compound called aminopterin, one of the first antipholates. He administered the drug to children with leukemia, terminal cases with nothing left to lose. The medical establishment braced for disaster, and then something happened that had never been seen before. One child's white blood cell count dropped, the bleeding stopped, the fever went down. For the first time in history, a cancer regressed because of a drug. It didn't last. The cancer returned, but that moment shattered the idea that cancer was untouchable. In those brief remissions, Farber saw a new path forward, not just for leukemia, but for all cancers. Still, not everyone agreed. Many in the medical community saw this as false hope, temporary, toxic, and emotionally manipulative. Farber's work was dismissed by some as sensational, but Farber wasn't just a scientist. He became a science communicator. In 1948, working with journalists and families, he helped launch the Jimmy Fund, a public campaign that humanized pediatric cancer patients and raised money for research. The face of cancer was no longer hidden. It was a little boy named Jimmy. Farber understood that the fight against cancer couldn't stay in the lab. It had to move into the public arena. He believed science needed allies, advocates, donors, families, and yes, even politics. Sidney Farber didn't cure cancer, but he changed what we thought was possible. He showed that cancer could be treated with a drug, a theory, and relentless optimism. In doing so, he laid the foundation for modern oncology. The battle was no longer hopeless. It had a front line. In our next episode, we'll explore how Farber's early victories led to one of the most ambitious science projects in American history, the war on cancer, and how it nearly unraveled under the weight of its own promise. Subscribe to follow the rest of the story.